Good morning and welcome to our webinar on complementary therapies. My name is Eleanor Quinn. Working alongside me today are my colleagues Linda Saunders and Jenny Burke, and together we will be facilitating today's webinar. Before we begin, it's just important to clarify that this webinar will focus specifically on complementary therapies. While we know the language can be confusing between complementary and alternate and is sometimes interchangeably used, complementary and alternate medicine are not the focus of today's webinar. However, that being said, we did receive several questions related to alternate medicines, so Professor Joske will touch on it a bit in his presentation, and we will address some of the questions in the Q&A. I'd like to begin by completing an acknowledgement of country. The Leukemia Foundation acknowledge the traditional owners of the various lands we are coming together on. We recognise their continuing connection to the land, sea, and the community. We pay our respects to their elders, past and present, for they hold the stories, traditions, culture, and hope for their people. So just a little introduction to today's session. So complementary therapies we know are common and widely used alongside standard blood cancer and blood disorder treatments. The purpose of today's webinar is for us to gain an understanding of the safe and effective use of complementary therapies, learn about the benefits and the risks of complementary therapy in improving your physical, mental, and emotional well-being, and empower you to seek out reputable sources of information to make informed decisions. So we've received a lot of pre-submitted questions, which is great. These will be presented to our speakers in the question and answer segment, the Q&A segment, and any questions from the chat will be collated and asked if we have time, allowing at the end. Just to remain relevant to everyone in the audience, we won't be able to answer highly personal or specific individual questions. And just a bit of housekeeping before we get started. So we've just got a couple of practical reminders. So microphone and camera functions are not available to you as audience members in the webinar format. The chat function is available and you can add a question or comment in there. When you do post a comment or question in the chat, just remember that it's live for the entire audience to view, and we just request that everyone is considerate and respectful, as I'm sure we all will be. So to introduce our first speaker, we've got Elle Halliwell. Unfortunately, Elle is unable to be here live today, but has very kindly and generously shared a recording for us. So before we get that started, I'll just read out a little bit of information about Elle. So Elle is an Australian writer, entrepreneur, and wellness advocate. After forging a successful career as one of Australia's favourite voices in fashion, lifestyle, and entertainment, Elle's life changed forever in 2016. Within the space of just 48 hours, she was diagnosed with chronic myeloid leukemia, or CML, and discovered she was pregnant with her first child, her beautiful son named Tor. Health and well-being have always been a passion of Elle's, and she is now a health coach, herbalist, integrative natural health practitioner, and auricular therapist. Elle is a Leukemia Foundation ambassador and works closely with us to raise further awareness of blood cancer. So we'll get her recording started now.
Hello everyone, I'm Elle Halliwell. I am a Leukemia Foundation ambassador and a journalist. I have been living with blood cancer since 2016. In May 2016 I was diagnosed, and 2 days later I found out that I was pregnant with my first child. It was a very difficult year, lots of very hard decisions that needed to be made, and I'm really happy to say that later that year I gave birth to a very healthy, happy baby boy, and I am currently in remission, which is exciting. I've been taking a form of tyrosine kinase inhibitor since I gave birth, which is nilotinib, or Tasigna is the brand name. It has a few side effects, which isn't that pleasant, but you know, it's keeping me alive. So I'm pretty thrilled and grateful to, you know, be living in a country with a medical system which is so wonderful, and yeah, very grateful to my specialist and all of the support that I've received since my diagnosis, you know, as well as all of the support from the Leukemia Foundation as well. I was, how do I put this? When I was diagnosed, my specialist was very helpful around, you know, what I couldn't take in terms of food that might interact with my drugs, but in terms of nutrition, in terms of how I could support my body and, you know, my mental health during this, you know, very distressing time, there wasn't much feedback, and I was kind of told, you know, pretty directly that, you know, these drugs would save my life, and there was no kind of hereditary element or lifestyle element that could have prevented what happened. So essentially, no kind of lifestyle elements would probably be that beneficial. Some of the complementary therapies that I found really helped me with my, I guess, you know, treatment, recovery, were really, really simple things. Gentle yoga, acupuncture as well, I found really helpful. And obviously, you know, just talking to someone about it. So seeing a psychologist was really, really important to me as well. I did have a naturopath who I regularly spoke to as well, who helped me, you know, just in terms of how to support my body nutritionally, any supplements that I might be needing just to, you know, keep my energy levels up and keep me feeling good, and to negate some of the side effects that I was experiencing with my treatment. All of these, you know, supplements and things were things that, you know, me and my naturopath had really closely looked at in terms of making sure that there were, you know, meta-analyses on the effectiveness of these treatments, and if there was any contraindications as well. So that was really important for me. I think that being able to educate yourself about knowing which sources to get the best information from is really, really important. So it's really kind of scary to scroll through TikTok and see, you know, some of these people peddling some very, very contentious cancer treatments when when they don't have the evidence to support it. And so what I tend to do is, if I do come across something like that does pique my interest, I will go to Google Scholar and I will search, you know, that modality or that herb or medicine, and look to see how much research, quality research, peer-reviewed studies have been done on, you know, that particular medicine or treatment. And then I would definitely recommend, if, you know, you do that as well, to, you know, print out those papers. If you are still interested in it, bring them along to see your specialist and just say, hey, look, this is something that I've seen, it's piqued my interest, and these are some of the studies that have been done on it, and get them to, you know, put their kind of scientific hat on and analyze whether or not these, this information, first of all, is legitimate, but then also whether it is something that, would be suitable for your particular situation, because everyone's situation is different. We're all unique individuals. So yeah, that would probably be my biggest tips.
That was beautiful. I know Elle's not with us today, but I just want to obviously thank Elle for her insights and sharing her approach to bringing complementary therapy safely into our treatment and wellness regime. That was beautiful. So I would now like to introduce Professor David Joske. David is a clinical haematologist at Sir Charles Gardner Hospital in Perth, Western Australia. David was head of department from 1994 to 2012 and a medical co-director from 2017 to 2021. David has received 2 National Health and Medical Research Council research grants. His research interests include lymphoma, palliative care in haematology, supportive care and survivorship in cancer, and psycho-oncology. He is a clinical professor of medicine with the University of Western Australia. David founded the Solaris Cancer Care Foundation in 2001. A recipient of the John Curtin Medal from Curtin University in 2004, he has been a finalist Western Australian of the Year 4 times. He gave the keynote Carl de Gruchy oration at the Haematology Society of Australia annual scientific meeting in 2019. He is a member of the National Blood Cancer Task Force and was on the Clinical Oncology Society of Australia Survivorship Executive from 2016 to 2021. He plays guitar and also has a songwriting award. Over to you.
Yes, thank you for that. And good morning, everybody. I'm just going to share my screen and open my talk. Hopefully you can all see that. I've lost view of the chat with this, which is a bit of a shame. I find it quite difficult to talk to a screen and be as lively as I normally would be. And it does help if I can see the chat comments coming back during it, but I can't at the moment. Maybe I can change that. But it's a great pleasure to talk about this to you all today, and I hope that I can give you some useful information and strategies. I'm also grateful to the Foundation for deferring this because I was very unwell and I'm still trying to get my voice back from one of those nasty upper respiratory tract infections. Complementary and alternative medicine or therapies. And some of the key topics that have come through beforehand to me are: what's the difference? Are they safe? What's the best time to use some complementary therapies? Where do you get the best information? And how to talk about this with your team. And there's a number of other kind of things that have come up, which I have just done some little things here. So is there a role for supplements and antioxidants? What's the difference between acupuncture and acupressure? Cannabis, mushrooms was another one that came up. What would I say to somebody considering going alternative? And in fact, this last one is very much a scenario that I have had quite, at times, very emotional discussions with people referred to me about going down an alternative path. And we'll talk about that. So very briefly, to introduce myself, I grew up in Perth. My father was Dean of the medical school when I went through, so I was a marked man. I trained at local hospitals in Perth and spent 2 years doing research into Hodgkin lymphoma in Switzerland, and then 2 years on a bone marrow transplant ward at the Hammersmith Hospital in London. Fantastic time for my wife and I. And then chance came up for a job in my hometown as head of department in my first consultant job in 1994, and I set out to create an academic quality haematology department in that hospital. We started a bone marrow transplant program in 1996. It's a whole other story, the Solaris Cancer Care story, but essentially because of a lot of feedback from my patients about complementary and alternative therapies, and when a chance came up for some funding, I created what would now be called a wellness centre within my teaching hospital, and that has grown into 5 centres providing access to safe and supervised complementary therapies in a number of locations across Western Australia. I got lured into the dark side of medical administration, and I can report that I'll be retiring to pursue a musical career this year. So I do hope that my 30-odd years in clinical haematology will be of some benefit to you, and I will pass the information on frankly, and very keen to receive your feedback. And I thought I would start by giving you the advice that I give to people under my care, and this is usually at about the second consultation. In medicine, we talk about the bad news interview, and there are guidelines for how to do that, and some people do it well intuitively, other people need training on it. But my habit then is to have a second long consultation and to go through a lot of stuff, really seeking to find common ground with people under my care in terms of shared beliefs and goals to get them through this journey. So my starting point philosophically is that there are 2 people in the room, somebody who's sick and somebody who wants to help. But ultimately, I deeply and profoundly respect the right of people under my care to make their choices about their health. That said, I do want the people to make those decisions on good information. All right, so what's it doing here? So the first thing I would say to people under my care is that you need to understand and be committed to your medical plan. And by this, I mean that you have a right to know exactly what your diagnosis is and how it was achieved, and the pathology reports that state that. And nobody should start cancer treatment without a quality pathology report confirming a diagnosis of a type of blood cancer in this case. My personal belief is that there is always a choice, but on the health professional side of the relationship, we tend to often assume what we think is the obvious thing to do. So I'm pretty careful to make it explicit that following a diagnosis of a blood cancer, the choices boil down to strong treatment for the best chance of cure or long remission, or controlling treatment, so-called palliative chemotherapy, or doing nothing. And I will try to give my best guess at the implications of each of those choices to a person under my care. Now, for example, if I'm talking with a 23-year-old woman who's been diagnosed with Hodgkin lymphoma, and the cure rate is 93% in Western Australia with the current approaches, then we would tend to assume that that's the right thing to do. But actually, it's the person's choice. What I do try and do is put out some kind of a rough roadmap of the dates of treatment and the side effects of treatment and the cost of treatment, not necessarily financially, much more about how much time is in hospital, the risks of extra time in hospital, the risk of infection, and so on, to give my patient their chance to say, okay, I see what we're trying to achieve. I see what the chances of success are. I'm going to do this. And people who've made that decision often find it much easier to get through the hiccups, and my nursing team find it a lot easier to manage people who've made a commitment to their treatment. But it is the patient's choice. And then the second thing I would say is that on top of understanding and being committed to the medical plan, you then need to make your own plan. as to how you're going to manage the situation. And this is really what I would call lifestyle management of cancer. And the aim of this is to reach a point where you can be calm about your diagnosis, so that when you wake up in the morning and it hits you again like a train, oh my God, I've been told I got non-Hodgkin's lymphoma and I got to have all this treatment. But Joski's giving us this treatment and I understand how it's going to work and how well its chances of success are. And I'm doing this, this, and this. I can manage this situation. Many of you have probably found people around you saying you have to be positive and you've got to fight this, and using very pejorative words. But I've come to believe that's actually quite a destructive notion. And there are plenty of times when people under my care say, I feel like crap today, doc. I really can't do the positive thing. And I've come to believe that it's much more important to get to a point where you can be calm about your diagnosis. And to achieve that, you need to have an understanding and buy into the medical plan and your own plan. And this is very different for different people. For some people, I would say probably regrettably, they choose to deny it. And their currency of communication with me is basically denial. And I come in and say, look, don't tell me anything about it, doc. Just tell me what I have to do and I'll do it. And there are ways of probing to make sure that that's the decision I've really made. Other people come into me with, they email me the night before with 20 questions or a clipboard with 10 questions on, and they're onto a strict regimen of yoga and meditation and so on and so forth. I think the point is that you can make choices such that you feel like you're comfortable with what you're doing to manage this diagnosis. And the aim of that is to get to a point where you can be calm about it, because then the cancer journey becomes much less of an ordeal. So I'll talk in a moment about these things very specifically. Generally speaking, and as I'll discuss, my advice is to leave supplements until after treatment. And instead of that, I would recommend a blended raw fruit and vegetable drink most days, and then you're getting vitamins in a physiological amount that is absorbable with roughage and so on. So I have a slide at the end, which I'm not going to show at the moment, which is my more specific advice to people getting chemotherapy. And I've put that in the talk really for people's interest. You can read that perhaps later on, or if we have time, I can go through that. But chemotherapy kills dividing cells by definition, at least traditional chemotherapy. And that means the friendly fire are the other non-cancer cells that are also dividing in the adult body, like hair follicles, the lining of the stomach, and the bone marrow making the blood cells. So the common side effects of chemo: hair loss, nausea, low blood counts. You need things in the diet that the body uses to make blood, B12, folate, and iron in good amounts. And again, I can talk in detail about those things. If there's any one thing that I think people can do to get themselves through the treatment of a cancer and out to the other side in the best possible shape, it's exercise. Chemotherapy dissolves muscle, steroids dissolve muscle, and the only way to keep that muscle is to use it. Use it or lose it. And we've kind of gone through 3 eras about exercise in terms of advice. The old advice was, when people on chemo were tired, was to rest. Turns out that's not very good advice. Then I at least went through a phase of telling people, look, try and get out and go for walks. Turns out that's better advice, but still inadequate, because you're not doing anything to keep the muscle mass in your upper body. And it's the loss of muscle that contributes a lot to the sense of fatigue that people have during and after chemotherapy. And I've been referred people 2 and even 4 years out from chemotherapy who still didn't feel like they were back to normal, and prescribed a resistance exercise training program at a gym that's got cancer knowledge. And those people within 6 weeks feel a sense of normalcy returning because they've restored the muscle mass in their upper body. So, and there are probably other benefits too. There are molecules called myokines released from muscle after exercise that probably interact with the immune system. And of course, exercise can also be social. And one of the things that we did with Solaris was start a thing called the Chemo Club, which was supervised exercise sessions for people going through chemo. And it would start with a walk around the Oval and a chance to swap stories and information and advice. All right, now the next piece of advice I would say is to resolve stresses. Get your life how you want it to be. And in fact, Carl Jung says we should all live our own myth. There's not hard evidence that stress causes cancer. There's a little bit, like recently bereaved elderly people, but no hard evidence. A little bit of evidence that it might promote cancer relapse. But in some ways, a diagnosis of cancer is a chance to reevaluate life and your life and how you want it to be. And in fact, Lee Sales in her book talks about this concept of post-traumatic growth, which is a wonderful concept. And intuitively, that's part of the reason I had started Solaris, because there is evidence that people who have good counselling supports are more likely to get to the end of their cancer treatment and arrive at a point where, in fact, their appreciation of life is enhanced. So one of the things you can do is, if you have an obvious recurring kind of festering sore of stress, resolve it. And I could give you examples from my own patients of how they've done that. And then the last thing I would say is trust your instincts. And I've got to be careful in saying this because some people's instincts are to avoid mainstream treatment, and they haven't really had a chance to get good advice on what it involves and what the benefits are. But if you do have a feeling that something's not right, you feel like you're not getting all the information you want, or the cancer's come back, or then act on that feeling and discuss it with your medical team. All right, so on to the definitions. And people talk about complementary and alternative medicine, CAM, as one thing, but it's actually a terrible term, and it should be complementary or alternative medicine, because alternative medicine is any health-related activity used in place of mainstream medicine. Complementary, that's with an E, not complimentary, which is free, or saying nice things like the peanuts are complimentary, the old joke. Complementary medicines are health-related activities used alongside mainstream medicine. And we're really looking to get the best out of both worlds. Alongside modern medicine, with all of the high-powered drugs and the gene therapies and the checkpoint inhibitors and the targeted therapies that we now have, we use some very ancient forms of, I use healing in the sense of getting people better, but not curing people, but some very ancient forms of health practice that can address cancer symptoms and treatment-related side effects. And in fact, we've now moved into an era of integrative oncology, which is the evidence-based use of selective complementary therapies. And so, for example, nearly all of the major cancer centers across the US, like the Dana-Farber in Boston, the MD Anderson in Texas, the Memorial Sloan Kettering in New York, they all have integrative oncology centers. And in Australia, we have Solaris in WA, which was kind of the pioneer, the Chris O'Brien Lifehouse at the Garvan in Sydney, the Victorian Comprehensive Cancer Centre / Peter Mac have a wellness centre, the Olivia Newton-John Centre, and the one called Bloom Hill on the Gold Coast. And we talk to each other across Australia, and we're trying to promote a dialogue on this issue. Humans love to categorize things, and we recognize kind of 5 different sorts of complementary and alternative therapies. The key thing I'd highlight here is that complementary and alternative medicines are those things that are ingested orally, the biologically based approaches. But we have manipulative and body-based therapies, mind-body interventions, energy therapies, probably the most controversial amongst the mainstream cancer community, and then whole alternative medical systems like Chinese traditional medicine. When you're prescribed a Chinese medicine, it's actually part of a more wider consultation. And Ayurvedic medicine has this concept of nirvana, which is perfect health as well. So I'm going to digress now, because of the number of queries about it, to talk about complementary and alternative medicines, and give you some cautionary tales and some personal experience, and I hope it's of interest. So really they fall into two groups: nutritional supplements, either to restore the recommended daily intake or using higher doses as therapeutic agents and the use of antioxidants, and then herbal medicines. To talk about them first, if you have a preparation of ginkgo or saw palmetto or something like that, they can vary very greatly across different brands and even times of the year, and across different manufacturing processes in different countries. And it depends in part upon where the herb is growing, how it's manufactured, which part of the plant is used, the stem versus the roots versus the leaves versus the flowers, and so on. So whatever might be the active medical constituents, their concentration can vary a lot in different herbal preparations. And so when I'm reviewing somebody's herbal medicine intake, I'm pretty careful to look at the actual bottles of what they are taking, and then go back to my reference works, which I'll talk about in a moment, to see what I think, if what they are taking is safe or dangerous. But I'll also make the point that some of our mainstream medicines are derived from herbs, like morphine from poppies, aspirin, Taxol from the yew tree, vincristine from the periwinkle plant, and so on. So herbs are just part of the sources of the treatment armamentarium. And to give you some example of some of the dangers, for people whose treatment might cause low platelets or as a direct result of their cancer, there are some complementary medicines which have a kind of platelet stunning effect, like aspirin, which makes people at risk of bleeding, particularly if the platelet count is also low because the platelets aren't working so well. And this includes high doses of garlic or ginger or vitamin E or ginkgo. St. John's wort has actually been shown in clinical trials to be as effective as antidepressants for some sorts of mild depression, but it has a big effect on the liver and the pathways by which chemo drugs are metabolized, such that the liver becomes much more efficient at metabolizing the drugs, and that effectively lowers the active level of the chemo drugs in the bloodstream. So it's like halving the dose of chemo you're supposed to be taking. And that happens with irinotecan and with imatinib, for example. And just to illustrate the complexity of this, I'll give you the example of green tea. It has high doses of this unpronounceable molecule, which has been shown to inhibit cell growth and induce cell death in some cancer cells without adversely affecting normal cells. And we got a grant from the Cancer Council in Western Australia to study a green tea extract in people with chronic lymphocytic leukemia, low-grade long-term blood cancer, to see if it could delay the point at which chemotherapy would be needed. And it had a mild effect in dropping the lymphocyte count in some patients. It did affect the liver in a couple of patients. So if people start this, then it's important they have blood tests about every month or 2 months to make sure it's not affecting the liver. So that's a good thing, that it might slow the progression of chronic lymphocytic leukemia without needing chemotherapy, but it also completely blocks the effects of bortezomib or Velcade, a myeloma drug. And so these preparations are complex, and their interactions with the cancer cells in the normal body and with the liver cells by which drugs are metabolized can go in different directions in different settings. And it's very important not to assume that because you've heard something good about something, that might apply to your situation. So onto antioxidants. Unfortunately, there's been no real evidence of benefit that I'm aware of to date. There have been large trials of taking antioxidants long-term to see if it prevented lung cancer. I've quoted one study that my hospital participated in down the bottom there. And my personal belief is if you're going to take antioxidants, I wouldn't take them during chemotherapy. There might be one or two that are probably safe, possibly coenzyme Q, for example. But again, I wouldn't make a blanket statement. I'd review an individual person's situation. And some of them have actually been harmful and have adversely affected cancer outcomes. So as I say, my advice to my patients is have a raw fruit and vegetable blended drink, an apple and a banana or something like that, rather than taking high dose supplements. There's been a lot of belief in vitamin C following a very deeply flawed study by a guy called Linus Pauling, who is a much admired biochemist. If you take vitamin C intravenously, and some of my patients do, it does achieve higher blood levels than you can get taking it orally, but there really hasn't been evidence of benefit in people with cancer, apart from a very few select settings. So we actually did use vitamin C intravenously alongside treatment with arsenic, strangely enough, for myeloma many years ago. Thankfully, we moved on from that era. And like anything that you swallow, herbs can have side effects. And this is a bit of a list here, really for your future reference. I was referred one lady, a patient in her 40s, who was taking large doses of herbal preparations and getting terrible headaches. And in the end, we pinned it down to this saw palmetto she was taking. When she stopped that, her headaches resolved. So herbs are bioactive molecules and not to be taken lightly. I've mentioned the risk of bleeding with people with low platelet counts and so on. Okay, so let's look at the evidence about complementary and alternative therapies now. So we've switched away from medicines. I reviewed this many years ago. The evidence has moved on a little bit, as I'll show. But my key take-homes for this are that acupuncture is particularly good for chemotherapy-induced nausea, particularly when it involves something called the P6 pressure point on the left wrist. It's good for cancer pain, and it may be good for some cancer symptoms like dyspnea and flushes. Exercise for cancer rehabilitation, but also during treatment. There's been some good work done at a centre in the southern US showing that it's not dangerous to exercise whilst you're getting chemotherapy, including drugs that can affect the heart like doxorubicin or adriamycin. Massage, it turns out, is particularly good at reducing anxiety in people with cancer. There are many different sorts of massage. There's no evidence I'm aware of that massage has promoted the spread of cancer in anyone, but most centres usually advise massage therapists not to massage known sites of disease. Massage has also been shown to improve quality of life. Music therapy, a particular passion of mine, reduced depression and reduced length of hospital stay in a bunch of bone marrow transplant patients in a famous bone marrow transplant centre in Seattle at the Fred Hutchinson Research Centre. And so on, psychological interventions, including counselling, do carry a risk. It's important counselling is done by trained professionals. Group sessions can go off the rails, but I personally am of the belief we need to get people who are going through the cancer journey talking to each other more and swapping stories and swapping ways to manage side effects and so on. So I mentioned the evidence has moved on. The medical profession places a great deal of faith in the Cochran database of systemic reviews. Archie Cochran was a chest physician who was captured and served as a doctor in a prisoner of war camp in World War II. And his experiences there led him to believe that a lot of things that we did in medicine were just tradition and not based on a good reason for doing it. And out of his work has come this belief in the evidence basis should drive our decisions about how we treat people. So what the Cochrane do is they look at clinical trials in a particular area for a particular thing, and they aggregate those trials which I think are of acceptable standard, and then analyze the pooled results which can give you much more powerful statistical evidence of an effect that might otherwise be missed in a smaller study. And these are some of the Cochran reviews that are relevant in terms of complementary and alternative medicine in cancer. And most of these studies report positive results that are equivalent to the kind of results that you might achieve with pain-killing or anti-anxiety or antidepressive medication. So these are non-pharmacological ways of managing cancer symptoms and treatment side effects. So let's look at this music interventions one in a bit more detail. As an example, here's Archie Cochran. Music interventions for improving psychological and physical outcomes in cancer patients. 52 trials, a total of nearly 4,000 people. Music interventions may lead to small reductions in heart rate, respiratory rate, and blood pressure, and have a beneficial effect on anxiety in people with cancer, a moderately strong positive impact on depression, a large pain-reducing effect, and a large effect on quality of life. Music listening may reduce the need for anesthetics and analgesics. So, to give you another example of a particular study that caught my eye, because I sing in a choir, they looked at singing in 3 groups of people affected by cancer: carers, bereaved carers, and patients. And they were regular participants in 5 choirs across South Wales who took part in an hour a week of group singing. And before and after the singing, they did these mood scales, stress scales, and saliva samples, and basically showed that singing associated with reductions in things that reflect high levels of stress. So singing reduced stress and had anti-inflammatory effects as well, reducing some of these cytokines like interleukin 2 and 4 and interleukin 17 and so on. So we're starting to get to an era now where we're collecting evidence at a biological and even a genetic level that some of these complementary therapies do interact with the immune system in beneficial ways. Exercise. As somebody has said that if exercise were a drug, it would have been patented by now and somebody been making $1 million or $1 billion out of it. It turns out that exercise can prevent cancers to some extent, and that this effect is specific to different sorts of cancer. And these are massive studies, sometimes involving tens of thousands of people over 20 years. And they've shown that exercise can reduce the risk of getting cancer and can reduce the risk of cancer coming back. In the case of colorectal cancer, if you exercise after diagnosis, it can reduce your relapse rate by 10%. We don't have that kind of evidence for the blood cancers. I've done some work with my team looking at exercise in bone marrow transplant recipients and so on, showing that it improves quality of life and reduces fatigue, but we don't know about any preventative effect and so on. And we believe exercise also has immune and mood benefits. And as I say, if there's any one thing I think people can do to help yourself get through all of this, it's exercise. Apart from the specific benefits, we've noticed through Solaris research that we've published that people coming in to a Solaris Centre and being offered a chance to try Reiki or Qigong or music therapy or massage, often is the first time many people feel like they've had a chance to start to make choices of their own about what's happening with their health. And this, in the medical jargon, is referred to as empowerment. And it's one of the things that you can do to start feeling like you're getting control back of a situation which otherwise has spiraled out of control. And so the benefits of complementary therapies might not just be biological in terms of reducing symptoms and side effects, but it might also be psychological in terms of being able to cope much better psychologically with what's happening to you. As to what's best or what timing is best, as a blanket statement, I say they've all been shown to be safe, and so they're okay to use all the way through. If you were in a clinical trial, you definitely need to discuss it with your team. But generally speaking, I couldn't see that any complementary therapies would be in any way prejudicial to a trial result. Some complementary therapies have specific effects that I've already mentioned to you. So these are the ones that I would use during my treatment if I was getting those sorts of symptoms or side effects. But the major benefit is this sense of taking control back of a situation. Okay, where to find good information? This has actually become easier now in Australia with the publication of this book, and I have my copy here, called Understanding Complementary Therapies. I didn't write it, but I was asked to review it and edit it, and I think it's fantastic, and it really has encapsulated a lot of the information at just the right level and appropriate to the Australian setting. And I'll give you an example of their discussion of acupuncture in a moment. Regarding complementary medicines, for many years I had this on my desk, and if somebody was referred to me, and occasionally because of starting Solaris and having a reputation as the alternative guy, I was referred people by my colleagues saying, could you please review this lady's herbs and alternative medicine intake and give us some advice on it. So not take over the care, but just provide a kind of third-party advice. I recall being referred a lady from a colleague of mine who was concerned about what she was taking, and it turned out she was taking 10 different preparations. Cost us about $300 a week, and I pulled out these books and went through all the things that she was taking in front of her so that she could see I was approaching it with an open mind, and we managed to rationalize down to about a quarter of what she was originally taking, and eradicating some potentially quite dangerous things. Probably a better guide now is an app on a smartphone that the Memorial Sloan Kettering put out called About Herbs. And this has greatly improved in the last few years, and it's an excellent place to look up stuff. You do need to read it in detail all the way through, because a lot of the information is buried a fair way down, particularly some of the risks. And I should have said also as a blanket statement, like any medicine, herbs can have individual, idiosyncratic, rare reactions that can be quite dangerous in an individual. And if you were taking something, it's important that blood tests are done regularly to check on your kidney and liver function and your blood counts in particular. From what I've said, you can see it's vitally important that you do discuss it with your medical team if you're contemplating taking something like this. So here's an example from the booklet. This is what it says about acupuncture. A definition here. Acupuncturist puts sterile needles under the skin into energy channels called meridians. These are the same meridians that Reiki therapists believe can be massaged without touching the body. We do Reiki in Solaris. It's very controversial. In our hands, some patients report quite profound experiences during Reiki, and I could quote specific examples. The theory of acupuncture is related to Chinese concepts of energy in the body, not a Western concept at all. And yet something like 80% of Australian GPs are quite happy to refer to acupuncture. And it is an example of where empirically the body of evidence has grown to a point that it's gained mainstream acceptance, even though the science behind it clashes with our own. Evidence suggests acupuncture may also help with chemotherapy-related nausea and vomiting, sleep disturbance and anxiety. It's quite good for peripheral neuropathy, which can be really hard to treat. But note this little note here. In Australia, the term acupuncturist is regulated by APRA, the Australian Health Practitioners Regulation Agency, and the Chinese Medicine Board. And so acupuncturists should be registered to be an APRA-approved practitioner in Australia, as one example of the local setting. So what are the warning signs that a therapy or a therapist might be dodgy? These are the ones that ring big bells, and they're actually in the booklet as well. If somebody claims a cure or miraculous results in other people, but then can't produce evidence of that, that's a big alarm bell. If it's expensive and you have to pay in advance, also a warning sign. If it's a medicine that's not listed with the Therapeutic Goods Administration. If the therapist is not qualified or registered. So for Solaris, we have about 150 therapists offering complementary therapies. And they're all registered with the highest appropriate professional association that we can find, and they have to practice with them for a year before they practice with us. If the therapist says you shouldn't use your conventional treatment or you should be changed, that also is an alarm bell. Conventional treatments have been established over many years with rigorous clinical trials and optimized as best as is possible for every person that is prescribed them. If you're told not to mention it to your medical team, that's a real alarm bell. And as Elle said at the beginning, if the therapist can't provide any trustworthy clinical studies, peer-reviewed, or if you have to travel overseas. So raising it with your team, this can be really difficult. Your team is concerned for your safety, and they should respond when you bring this up with an open mind and be prepared to discuss the pros, the cons, the dangers, and the possible side effects. That said, not all health professionals have been prepared or are able to synthesize all of this knowledge. I'd make the point that for my registrar's training in haematology and for consultants in haematology, to keep up with our area alone, it's been estimated you need something like 29 hours a day to read the stuff that comes out in a particular area of haematology. Obviously not possible. So to ask busy health professionals to then take on board learning all about all this other stuff is a big ask. And I've seen it as part of my role as a pioneer in this area to assimilate the knowledge and disseminate it as best I can. And a lot of it is, in fact, now in this booklet. I started Solaris in 2001 after one of my patients said to me that he'd learned not to talk to Dr. X or Nurse Y about what he was doing to try and improve his health. And I realized that for some people, raising this topic can be a deal breaker with your team. And I've heard terrible stories of people being refused treatment because they've tried something, often on bad information. So this can be a difficult area. Nevertheless, the evidence is in, and I think a good way to approach this is to turn up saying, I'm interested in doing this and it's in this booklet, and is there any problem with me doing this, or do you have any other advice? Your team and you should be in the same boat, rowing together in the same direction to achieve the same goal. All right, cannabis oil in WA, and I think most states, it's an S7 medication. It's highly regulated, and in WA, prescribers have to apply to the WA Department of Health to get approval to prescribe it to an individual. There's two main components. THC, tetrahydrocannabinol, is the major one that gives people a high, whereas cannabinoid, and there are different cannabinoid molecules, is the major non-psychoactive cannabinoid. Both of them may have therapeutic effects, but generally speaking, prescribers will prescribe a mixture of these and then reassess how somebody is responding to these and rejig the components so that there aren't side effects. I don't believe cannabis has anti-cancer effects as such. And I know Olivia Newton-John went public on this, and I think that was very destructive and very unfortunate. And in fact, there are evidence that cannabis can worsen results with drugs like nivolumab or pembrolizumab, the checkpoint inhibitors, where they've shown a reduced tumor response in people taking cannabis. I've had patients though whose who tell me their lives have been saved by cannabis because it got them through chemo. The nausea was much better. The anxiety was much better. And so it definitely has a role, I think, for pain and for nausea. It probably is a good anti-epileptic in kids with refractory epilepsy, but I don't think it's an anti-cancer drug as such. So quickly, some of the other things that have come back in the feedback. Massage is safe, full stop. Use of complementary therapies in trials, you must discuss with the team, but if it's a mind or body-based intervention, it's almost certainly going to be okay. When is most beneficial? I'd say all the way through, particularly exercise. Just a footnote, I guess, on exercise to say that exercise doesn't mean you're out to establish a personal best every time you go out. It's more a judicious blend of light cardio, such that you can still finish a sentence if you're talking, and some resistance exercises that cover most of the main muscle groups. And there are actually online tutorials on this available through Solaris and other websites that give you, and most physios now, and certainly a lot of the exercise physiologists, are on to advising people how to exercise through chemotherapy. Dealing with unsolicited advice. This can be awful for some people, and you get a constant barrage of other people saying, oh, you've got to go to Mexico and try this, or you've got to go and take shark cartilage, or I've heard this and this and this. You have the absolute right to decide how you are going to manage your health. And that includes medical advice and includes lay advice. And my suggestion is to firmly make it clear that you've worked through things, you're grateful for the advice, but you're at a point now where you're happy with what you're doing to manage your situation. You're happy with the medical plan and you're happy with your own plan. There isn't much evidence about complementary therapies in children or adolescents. We were approached by the Kids Hospital in Perth. It's very difficult work to do. In fact, it's very difficult research to do generally. To give you one example, I'm aware of a study in acupuncture where they use sham acupuncture needles, like stage daggers, where the needle disappears inside the hilt and it doesn't pierce the skin. And that study showed that with real acupuncture, the positron emission tomography scans of the brain changed versus sham acupuncture in people with chronic arthritis pain. Again, showing a biological effect. But a lot of the complementary therapies can't be done as randomized controlled clinical trials. And that leads to a lot of skepticism in the health profession, for whom randomized trials are the gold standard. I could talk more about that, but that's enough for now. Cannabis oils and tyrosine kinase inhibitors used for CML, as El discussed. I had a look at this, and it seems that there are some interactions with imatinib and nilotinib. Dasatinib might be safer, but imatinib and nilotinib might potentiate the effects of CBD, causing cannabis side effects like anxiety, highs, confusion, depression, hallucinations, and so on. Mushrooms, very much in the people's minds at the moment after that dreadful thing in Victoria. To my knowledge, there's some evidence work done in Japan with shiitake mushrooms that they may have an immunomodulation effect on T cells, but no clinical trials that are positive or reputable to my knowledge. I was asked about mythbusters, sugar and cancer, the low sugar diet to starve the cancer of sugar. Unfortunately, cancer cells get what they want, and all you're doing is starving the good cells of sugar as well, and something I'd strongly discourage. Shark cartilage isn't absorbed. It doesn't really do anything. You swallow it, but it doesn't get into the body. Laetrile is the pips of apricot kernels, and actually they contain high levels of a heavy metal. So it's basically like mercury or silver poisoning, in fact. And I've spoken about vitamin C before. So to sum up, I'm sorry if I've gone on too long. About 40 to 70% of cancer patients worldwide will use some kind of complementary alternative medicine. It's imperative, I think, that the mainstream health community recognise this, learn about it, and can give people open-minded advice about it. Selected and supervised complementary therapies help reduce cancer symptoms, help reduce treatment side effects, and empower people through the cancer journey. Exercise may have primary and secondary cancer effects, boost immune function, retain muscle mass, and is now being studied during and after chemo. Oral and herbal supplements may be harmful or dangerous. It's vital to have clear communication between patients and your teams. So that's the talk. I do have some more slides. I've got some slides about Solaris. I think I've got this one about advice to people on chemo. It's a very busy slide, and I don't want to go through all of that now, but we can talk about that later on if desired. So I'll stop the share and throw it over to the group now. And I hope that has been useful and helpful.
David, that was wonderful. Thank you so, so much. I feel like it was almost mean getting you to cram that into such a small amount of time. And I know that a lot of people will be able to take away some really practical tips from your presentation. Thank you. I'm now going to introduce our final speaker for today. We've got Sophie Pattercroft-Gray. Sophie was diagnosed with acute myeloid leukemia, or AML, in 2019 at age 29. Sophie had a stem cell transplant later the same year from an unrelated donor and has been in remission ever since. After leaning on her yoga and mindfulness practice heavily through her recovery, Sophie underwent her yoga teacher training and teaches in Adelaide. Sophie has undertaken further education in accessible yoga, yoga for cancer, and working with those with a disability. Sophie is now running her Yoga After Cancer, Coming Home to the Body course in person in Adelaide and shortly online. I'll hand over to you, Sophie.
Great, thank you so much. And thank you, David. That was some really great information. I really wish that there was a holistic cancer centre in that way here in Adelaide. I think that would be very, very beneficial for a lot of patients. My experience with complementary therapies, once I was diagnosed, that was an avenue that I really wanted to go down. I first got in touch with a naturopath who specializes in cancer, and she gave me, based on my diagnosis, a really big plan of lots of good nutrition tips, some supplements that I could be taking that she recommended, and really making sure that I was looking after myself. Whilst that was really helpful, when I did take those to my doctor, to my consultant, we discussed it and made the decision that I wasn't going to take any supplements through chemotherapy, that I was going to leave that to chemotherapy, to the doctor, and also during my stem cell transplant, that there is so much going on that we don't need to be throwing in other things for there to be potential risks involved. There's also a really great a private holistic cancer centre in Adelaide as well, which has a lot of subsidised treatments for people undergoing cancer treatment or in cancer recovery. So I felt very lucky that I was able to go there, and obviously the practitioners there have got that understanding of what you're going through, of the risks involved. You know, are you on active treatment at the moment? How are your platelets doing? And really have got that basis. And that would be a strong recommendation of mine if anyone is going to see practitioners, to of course make sure that they're qualified and experienced, but to also let them know of what's going on, what's your latest treatment, how your blood's doing. What have been the main things that are coming up? What medications are you on? In terms of other modalities that I used. Obviously, I've got my yoga practice and my meditation and mindfulness practice, which I really was able to lean upon and to strengthen in that time. You know, we do these practices when we're in good health, that hopefully they take us through those rough times as well, and those periods of stress. And I really related to what David mentioned about, you know, once you get the mind and get that sense of calmness and acceptance into what's happening, you can really start to enter everything from a slightly better state of mind. You know, when we're panicked and we're in that fight or flight response, it's very hard to unwind and to de-stress and to be able to make rational choices and decisions. So that was something that was really good. I leaned upon lots of meditation techniques and visualizations as well. So I had one visualization that I would do before I was going to sleep, where I would imagine these little kind of Pac-Man figures that were in my body, and they were eating all the cancer cells. You know, I had another one where I was just surrounded by real healing light, and being able to change the perception that I had around chemotherapy, which was, to be honest, quite negative, that it was this poisonous substance that's being brought into your room with nurses in hazmat suits, and it's fluorescent orange, and you're thinking, oh my gosh, this is about to go into my PICC line. I spoke to a very dear friend of mine who, when she was going through treatment, flipped that. She had these beautiful stickers and love hearts, and she put those on her chemo bag, that no longer was it, you know, this foreign thing that we would never put in our body, you know, this sort of bright orange colored liquid, to something that this is going to cure me, this is to help me. And I think that there is so much of that around perception and state of mind that can be very helpful. Again, I was juicing when I had the neutrophils, where I was able to. Obviously was very careful with that after my transplant, in making sure that fruits and vegetables were safe, they were washed, and just doing things that I could manage that would also fill up my cup. You know, sometimes we can also take a lot of burden on ourselves, that we should be doing all this, you know, these huge number of things. We've also got to take time and, you know, be able to do the things that are good for us on those days that we feel well. Maybe that's a short walk. Maybe that's driving to the beach and sitting in the car and just looking at the ocean, because that's what you've got the energy to do on that day. You know, there's that fine balance between doing the things that make you feel good, but not feeling that sense of guilt for not being able to exercise and do this and juicing and eating healthily and getting that social connection, because sometimes it's too much, and sometimes you do just need a day in bed too. Yeah, I can't think of many different modalities that I didn't try. So from massage, Reiki, acupuncture and acupressure, talk therapy, seeing a psychologist, again, to be able to process what I was going through, to have that calm state, calmish, I'm not gonna lie, calmish, some of the times not so calm, but to be able to really process everything that I was going through and be able to be present with it and understand things. And I found that good. You know, I wasn't getting triggered and wanting to scream all the time, because it's frustrating. You know, no one wants to be in hospital. So that was really beneficial to me, and I really highly recommend that. Yeah, as well as dietary changes, just being conscious about what I was eating, just trying to eat more fruits and vegetables. Again, without that pressure. I love hot chips. That's my thing. And that's good, because that made me very happy to eat. So, you know, again, it's all about that balance. Don't be too hard on yourselves as well. In terms of, yeah, kind of knowing whether I was going to the right people and getting that right support, making sure that there was an understanding of what I was going through with those practitioners and how that might affect the treatment that I was having. You know, certainly no acupuncture with low platelets and things like that. I'd also run a lot of things past my doctors. I had two very different experiences at the hospital when I was going through my first induction chemotherapy and then my stem cell transplant. The first consultant that I had was very against any complementary medicine or therapies, any talk of it. It was, you sign into this, you were doing this regime with me, and that's how it's done, and I don't wish to talk about anything else. I found that very frustrating. You know, I've read somewhere that it's a consultant. The job is to consult, not dictate. And that needs to be that open dialogue that David spoke to as well. So I did move consultants and am under the care still of a different doctor, a different haematologist, who was very, very open, receptive, and honest about the treatments that I wanted to do. And that really fostered this mutual respect. He took the time to explain what side effects might happen, the risks that could give to me. And so that then I could make an informed decision about risk and reward. You know, taking a supplement during chemotherapy, during a stem cell transplant, once I understood that risk, that, you know, of how serious that could be, you know, okay, I'll leave it. I'll take it in a few months' time. That's fine. Because there's also got to be that trust that I'm going through this big procedure with doctors that are very, very highly specialized in their field. And there is that complementary side of it, that those things can come in their own time and place as well. I was also able, once I left hospital, to talk to the pharmacist there. If there were things that I wanted to take, I would call him up or send him an email and just say, hey, I'm wanting to take this. Is this okay with the medication that I'm on? So that there was that informed decision that I could make. And I feel very lucky and very privileged to have had that relationship with the staff at the hospital, because I know that that won't be the case for a lot of people. And unfortunately, it is a difficult and tricky situation when you feel like you have to stand your ground for what you believe would be right for you. Yeah, I think that pretty much sums up my whole experience. There's also that sense of community that I was able to foster and get at that time, particularly on Instagram. I connected with a whole load of other patients going through a stem cell transplant all around the world at that similar time, and just even to be able to relate and just say, oh my gosh, I'm so tired, I'm so fatigued, I'm so, you know, this, that, and the other. And you've got someone that's not in your direct circle, they're not a friend or a family member, someone that can relate and you can just vent with, and you feel a lot less alone. That's something that I found really beneficial too. So community is a big part of what I want to bring in my Yoga for Cancer course, which starts in September. As mentioned, in Adelaide, and then hopefully in the future online, to be able to really get that community around Australia too.
Sophie, thank you so much. That was beautiful. Hot chips also make me happy, and I'm sure a lot of other people in the audience as well. But that was just gorgeous. Thank you. We really appreciate you sharing your insights and experience using other complementary therapies alongside standard treatment. So thank you. So Sophie is very kindly now going to guide us through some chair yoga exercises so that we are all feeling relaxed and energized for our Q&A segment of the webinar. I will just mention here, if that's okay, we're probably going to run a few minutes over time, maybe about 10 minutes over time, but bear with us. I'll hand back over to you, Sophie.
Beautiful. Thank you. So I just wanted to start with a little breathing practice. So often, I'm sure everyone will know the feeling of when we're perhaps a little bit nervous or stressed, maybe when you walk into the hospital and you're going for checkups or for treatment and you start to feel that maybe a little bit sweaty and the breath has started to shallow. Wanted to take this practice to really ground down. So this is something that I use. It's called a physiological sigh or a cyclical sigh. If you want to Google it, there has been a lot of research into just this very simple breathing practice. So we'll be taking 2 breaths in through the nose to each long breath out through the mouth. And we want to try to fill up the lungs as much as we can here. We'll start just getting into a comfortable position. We'll take the feet down on towards the floor. We can take hands down on towards the lap, rolling the shoulders back. Always the option to close down the eyes here. We'll start to drop in towards the breath. And let's exhale our breath here just to synchronize. And then we'll take a deep breath all the way in through the nose, sending that breath down towards the belly. Then we take another breath all the way up towards the top of the chest, filling up the lungs as much as you can. We open up with the mouth, take a long sigh out, let it go. We want to really squeeze out all the air as much as you can. Then we take another round in through the nose, sending this one down towards the belly. Another breath up towards the top of the chest. And then a long sigh out, let it go. And we'll go for one last round here. So a deep breath all the way in through the nose, down towards the belly. And we'll go up towards the top of the chest, filling up the lungs. Open with the mouth, sigh it out, really let the breath go, let the shoulders sink. And finding yourself just grounded onto your chair. From here, let's soften across the face and across the jaw. Maybe you feel like there's a bit of space between the top and the bottom teeth, and the tongue can relax down towards the base of the mouth. And very gently and very slowly here, start to move the head over towards your right-hand side. So we can do that as we take a breath in. And as you exhale, we'll take the face back in towards center, going straight ahead. And we can take the chin over towards the other side. With your exhale, coming on back towards center. And then from here, we'll drop the right ear to shoulder. We can take a breath in and find length all the way up through the spine. And with your exhale, ear just drops down. Take another breath in. Find length up through the spine. And as you exhale, the ear comes to the other shoulder. Okay, we'll come on back in towards center here. If it's comfortable for you, we'll start by lifting the arms all the way up and overhead. We don't really need to be super high, just whatever spot feels comfortable here. We can find that length up through the spine. Crown of the head lifts as the tailbone sinks. And we'll take another big breath in. And as you exhale, we'll take the right hand forward, the left hand just comes back just slightly here. So a gentle twist. We can take that right hand over towards the outside of the thigh and use that as a slight leverage to twist through the body and through the spine. And take the head to look out to the side. With your next inhale, we'll use that inhale to take the hands back up and overhead. Get length from the crown of the head to the tailbone. And then exhale towards the other side. We'll spend a full round of breath here, breathing in deeply. And then exhale fully. From here, let's come on back towards center. This is my favorite practice now. So we'll clasp the hands together and place them on towards the heart here. And we want shoulders back, so lots of length up through the neck, and the elbows can be nice and heavy. We'll take a deep breath in and imagine this breath filling up through the heart space, filling up through the back of the body. And then take a big sigh out. We'll take another deep breath in here. And as we exhale, we'll flip the grip on the hands and start to push the hands away from you. And we can maybe start to get some rounding through the spine. Perhaps the chin comes down towards your chest. With your breath in, we're finding length up through the body. So the arms come up and overhead. We're lifting up nice and high. And as we exhale, separating the fingers, we can bend through the elbows to create this cactus shape here, and the shoulders come behind to touch. Nice. So we'll keep going for a few rounds with the breath. Hands come onto heart. We take a big breath into this area. With your exhale, flipping the grip, and we can push away, rounding through the spine, getting a stretch between shoulders. Yes, we'll take another big breath in, fingertips raised up and overhead. As you exhale, separate that grip, elbows come wide and coming down. Let's go for one more round here. We'll take hands onto heart, deep breath in. With your exhale, sending it away. Rise up on your inhale. And as you exhale, open through the chest, elbows wide. Yes. From here, we can drop the hands down towards the lap. Just take notice of how you're feeling. Maybe there's been some changes, maybe there's not been, and then we've just stretched, and that's good too. But yeah, I just, simple breath practice is really beneficial, particularly for those stressful times, as I think we all know too well. We've always got the breath with us, and we can use that to really try and just calm our bodies and go in with a little bit of a clearer mind into those situations. So yeah, thank you.
Thank you, Sophie. That was beautiful. I haven't been relaxed in weeks, I don't think. That was really nice. I'm sure your online business will do very well in reaching a lot of people across Australia. That's amazing. So we now have an opportunity for our Q&A, our question and answer section. So I'm going to hand over to Linda.
Thanks, Eleanor, and thank you to Sophie and David. It's been an incredibly enlightening session. And even as someone who works in the field, I've learnt so much today. And certainly some of those key messages around that herbal, natural, doesn't necessarily always mean safe or better. And what works for one doesn't necessarily work for someone else. And David, I really like in one of your earlier slides around it's more important to be calm than to be positive. I think there's a lot of conversations around that positive mindset, and that is really a very unrealistic state to often achieve for people who are living with blood cancer. So I have to say you have covered probably about 90% of the questions that we have. But what I want to do is invite Sophie into that conversation as well. I am also very mindful of the time, so we'll try and be really quite precise in some of those questions. You really covered the benefits and the safety aspects of complementary therapies, and also covering some of those alternate medicines as well, as since we received quite a few questions in that space. You mentioned that obviously complementary therapies can be used really along the whole trajectory, including during clinical trials, but to obviously have those conversations with your treating team. Can you talk a little bit more about any particular considerations for people post-transplant? And perhaps Soph can also comment about that. Obviously, it's a more intensive type treatment. Is there anything else that people post-transplant need to be really considerate of?
Well, I'll put my penny's worth in first. I don't have Sophie's lived experience, and our transplants were all autologous, so self-bone marrow transplants, which carry less and different risks than transplants from somebody else. But generally speaking, with a self-bone marrow transplant, the blood counts recover at about day 12 to 14. With an allogeneic transplant, it's often twice that. So there's a much bigger risk of infection during that period. And so a lot of people are able to go home about 3 weeks after they've had their chemo. And the doses of chemotherapy used in a stem cell transplant are up to 20 times the doses that you can give when you're not limited by the effect on the bone marrow, because effectively with an autologous transplant, you rescue the bone marrow by reinfusing some stem cells back that you've collected earlier. And that sounds really scary, but because you're not limited by the effect on the bone marrow, we pick conditioning chemotherapy drugs where the main side effect is on the bone marrow. So for a lot of people, having a stem cell transplant, an autologous one, a self one, it's not that much different to the chemotherapy leading into it, at least with the older traditional chemotherapy regimens like ICE and DAC and so on that we use for lymphoma. Nevertheless, because it's a bigger dose of chemo, there's much more muscle loss, and people have been hospitalized and bedbound often for quite a bit of that time, and maybe getting fevers and so on. So when the time comes to discharge somebody from hospital, I will say to my patients, look, we think you're safe to go home now. You'll have a contact point. The risk of infection is still there. Your blood counts have recovered, but the immune system's still got a long way to go to fully recover. And so if you get a fever, you need to get straight back in touch with us. And you'll find it a shock when you go home, because you go to do things which are familiar and normally easy, and you'll find that they're harder than you thought. And in fact, doing those things is part of the rehab. And so we are making a decision to let you go home as early as we can, not because of the financial pressure on the hospital, but because we think it's the best thing to do. And just those activities of daily living are part of the rehab. And then there'll come a point, typically about 4 weeks after an autologous transplant, where you'll feel like you're starting to resume exercise again a bit more fully, and then get back into some light cardio and the resistance stuff. Don't expect every day to be better than the last. There'll still be an occasional bad day, but look for an overall improvement. The first day might be walking out to the letterbox. Second day might be 100 yards down the street. And then most days, apart from hiccup days, you should be able to do a little bit more, and so on. A lot of people, in my experience, it's a bit different with transplants, but a lot of people psychologically have this kind of chase the tiger syndrome, where they're really processing, is the word Sophie uses, and it's the right word. They're squaring up with what's happened to them at the end of treatment, not during it, because everything else is on ice. You're worried about getting to your appointments and the impact on your kids and the loss of your job and all of those sorts of things. And so we're pretty careful to provide access to counselling if we can, after periods of intense treatment, more than during, because that's really often where the square up comes, and people have time to, it's the chase the tiger syndrome. You run away and now you realised what the heck just happened. So the psychological recovery from intensive treatment like transplants is often longer than the physical recovery, and Sophie might have better comments on that I can make. But the key thing is to be patient with yourself and allow time for the improvement to happen, and it will.
Sophie, did you want to thanks David for that, add to that commentary based on your experience?
Yeah, I think it's a hard one with recovery, because I felt after my stem cell transplant it was a year recovery to just get back to, I don't know, doing the usual things, I would say, and then a year to get back to myself. That's what I felt like for me personally. I did have some issues come up with GVHD and the like. I think
Yes.
I was also lucky with the psychologist that I had through the hospital. Was very versed in I suppose fatigue management and how to really make the most out of your day, but without overdoing it some days, because then you go through this roller coaster of having a day where you think, I feel great, and you think this is amazing, and you try and do all the things, and then the next day you're absolutely wiped out because you've done too much. And then you're on that thing of, oh gosh, now I've spent the whole day in bed and I've wasted a day. And, you know, riding those waves is very tricky. And particularly when you've probably just spent an awful lot of time feeling so rotten and in hospital and receiving chemotherapy, you want to be going out and doing all the things that you've missed out on. In a way, a big part of my recovery was during COVID, and they're nothing. I was isolating. So I had to try and manage that fatigue of like David mentioning, hey, I'm going to go for a walk and it's going to be this long. And then tomorrow it's going to be another 50 meters. And then I'll go around the block again, and just go in that way. So it is a hard thing, to manage, but that would be my advice. Just, being kind to yourself. A return to exercise program, I think, as Jenny mentioned in the chat, I think it's so helpful just to have that slow progression, because so often we're trying to get back to the image or the vision that we had of ourselves before we were sick. And that is a big imbalance because our bodies have been through so much. Mm-hmm. So to move away from focusing on getting back to what we were before, how we visualized ourselves, you know, what we were able to achieve in a day, to, okay, no, look at me. A month ago, I was bedridden in hospital. Like, how far I've come from that, you know. And as that time starts to separate, to look back and say, well, wow, I was really unwell, and really suffering with treatment then, you know, going from that stage, rather than, oh, when I was running and doing this and all of those other things before illness. So yeah, that's what my thoughts are.
Thank you so much, Sophie. We do have a few more questions, particularly around, you know, we live in a world of having access to a whole lot of information, and that includes our family and friends. And they often want to do what's best for us and encourage us and share information that they may have heard or read about regarding various therapies, oral medicines. You know, Sophie, in particular, I'd like to direct this question to you. How would you suggest that someone, you know, manages that that conversation when people offer up advice that may be unwarranted or unasked for, but we know it's usually really well-meaning? You know, could you give us some tips for how you may have navigated that?
Yeah, a tricky one, a very tricky one. Look, it was much harder when I was, you know, in the real thick of treatment. Might have potentially wanted to say some rude words to some people. Gets easier with time. And I think just having that thought that, you know, people are saying things from a place of wanting to help. As humans, we want to try and help each other and try and think, oh, maybe this can fix them and maybe I can do that thing. And so often, you know, we want to just be listened to. And sometimes the best thing that people can say is just, yeah, that is a bit rubbish. That is a bit crap. So I think saying things like, oh, thank you, just very simple, thanks. Like, you don't need to enter a dialogue if you don't want to. That's another thing too. It's up to you how much you want to disclose and discuss about your treatment and about your thoughts. It's not for anyone else as well-meaning as they want to be. So I think having that authority that you don't necessarily need to give a reason to some people, but say thanks. Thank you for thinking of me. Thank you for your concern. Yeah, if there's people, you know, really badgering on the point, I think asserting that this is not necessarily the best thing. Okay, thank you for your concern. I'm obviously dealing with a lot right now, and this isn't productive to that, so I'm not going to be discussing it any further. Things like that, you know, if people do want to help, and it's hard sometimes, but yeah, I kind of come back to that with a big breath and a let go. But yeah, you know, yeah, people were wanting to come from that sense of love, but sometimes it's a little bit not too beneficial.
Yeah,
I have one
Mm.
other tip that I would add to that, which I think applies particularly kind of in the early days after diagnosis, or if you're having a spell in hospital, and it's a lot of time in hospital with AML, and that is to appoint a spokesperson. So if you can, if you've got a brother who lives in a different house, or a relative or a friend, you give them updates and you tell everyone to call them. And the advantage to that is you don't have to talk about your illness all day. And you can regulate the flow of information, and you don't have all this unsolicited advice pouring in every time somebody rings asking for a catch-up. So appointing a spokesperson can work really well in some situations for some people.
Yeah, absolutely. Your focus is then on your treatment and just managing that. And probably, you know, I wonder if another strategy would be to provide people with some education as well, your family and friends, and to share the literature, you know, that complementary therapy booklet that's produced by the Cancer Council, you know, to help inform, because often it's, like we said, ill-informed but well-meaning advice that's often shared. So we have a role in educating the broader public and our broader communities around this particular topic. We do need to draw this webinar to a close, so I will hand over back to Eleanor for some final comments. But would love just one message. If you had to give one message for the audience to take away today, David and Sophie, what would that be?
I
David,
think my
thanks.
message to my patients is, you have the right to manage your health and your illness, and everybody else has to take a backseat to what you want to do and how you want to play it.
Perfectly said. Thanks, David. Sophie?
In a similar vein, really, you do you. You know, this is not the time to really have to take into thought what other people want at this time. And I think that real nailing down of what's important to you, how you want to manage your illness, your treatment, your recovery, find that and do that, and find the people that best support you within that.
Incredibly sound advice. Thanks, Soph. Eleanor, back to you.
Thank you.
Thanks.
Thank you so much. So there's obviously been an incredible amount of information provided today from our excellent guest speakers, and this now draws our webinar to a close. I'd really like to take this opportunity to thank the supporters of the Leukemia Foundation, as without them, we'd not be able to deliver education events such as these. All our guest speakers, we obviously thank you for generously sharing your knowledge, expertise, and time with us today. And most importantly, all of you who have joined us today, we encourage you to use the information to start conversations with your healthcare team and family and friends to help guide your blood cancer management, health, and well-being. And always remember to ask about the costs before considering any complementary therapies, and explore the credentials of your preferred practitioner. Also, just to let people know in our audience, if you have any questions or concerns, I know Jenny's mentioned this in the chat, but we encourage you to check out the resources on our website, or give us a call on 1-800-620-420 to speak with a blood cancer support coordinator in person. Our blood cancer support coordinators are always here to help We can provide emotional support and refer you to other services within the Leukemia Foundation or outside the foundation. A survey email will be sent to everyone tomorrow, and we really appreciate hearing your feedback so that we can bring you more of what you might need. Finally, I'd like to remind everyone that a recording of the webinar will be made available in 1 week on our Leukemia Foundation website and YouTube channel, and it'll automatically be emailed to those who are registered for today. Thank you again, everyone, and goodbye for now.